I'm Harry Kim, Director of Center of Excellence in HIP at Scottish Rite for Children in Dallas, Professor of Orthopedic Surgery at UT Southwestern Medical Center, and the chair and a founding member of the International Perthes Study Group. So I want to present this work, which is now published in the Bone and Joint Journal, December 2022 issue. And it's addressing this question: how are adults who had childhood Perthes functioning? And this is a result of over 900 survey participants from an international web-based survey. So we were curious about this question of how does Perthes affect the quality of life in adulthood, because we know that some of our children go on to have a round, from a head that looks mushroom shaped or not completely round. And we do know that that is at risk for developing arthritis. If you look at the medical literature, there's really very little published information on how patients are functioning, especially from their perspective of how they're functioning. A lot of our studies are based on x-rays and what we call physician or doctor based assessment, and not really on a patient's perspective. So our goal was to collect a large patient-reported outcome. So what this means is we survey the patient, and patient will let us know how they're functioning, whether they're having symptoms, and what issues they're having according to the questionnaire that's given. So we wanted to collect a large patient-reported outcome data from adults who have a Perthes using a web survey, and then compare their results to a normal population result that we already have. So we built a web survey in English and made it available in IPSG website, which is the perthesdisease.org. And we advertise among Perthes support groups and IPSG Facebook. This is important because this will then get attention of people who are into social media or who are have sort of membership or site into these areas. So it is to some extent biased that way. Our survey consists of childhood and adult Perthes history, like age at onset and treatment they receive, as well as BMI, and the UCLA activity score, which I will explain. Along with that, the important aspect of the survey was to assess the hip disability and osteoarthritis outcome score, which has 5 categories listed here, asking questions about symptoms, hip pain, functions in their daily activities, as well as during sports and recreational activities, and hip-related quality of life. We also question the survey participants about their general health, which is related to the physical function, pain, general health, vitality, social function, emotional aspect, as well as mental health. So looking at the participants, we had 921 adults take the survey, and these are, and we're just looking at the patients or the participants who did not have a total hip replacement. So we had 44% were men and 56% were women. And this graph basically shows the age range that goes from age 18 to 75. And you can see the bulk of the people that took the survey had an average age of 38. And the average duration from age at onset to survey was 30 years. So you kind of see this as maybe a 20 or 30 year outcome of a patient who had Perthes earlier. So most of the survey participants were from 4 English-speaking countries, and that makes sense because the survey was in English, with US being the predominant country where the participants came from. And we found that 93% received some form of treatment, and some participants had more than one, and that's why these numbers will add up to more than 100. And looking at the UCLA activity score, so the score of 1 means I'm wholly inactive and dependent on others, and then 10 is I regularly participate in impact activities like soccer or tennis or things like that. So men had an average score of 7.2, which was higher than women. And the score of 6 means regularly participate in moderate activities, and whereas 7 is in active events such as bicycling. So this is the sort of important finding about the hip disability and osteoarthritis outcome score. And surprisingly, we found a huge gap. So I'm going to just explain this graph, okay? So male normal population is light blue and female normal population is pink, whereas the male Perthes and female Perthes, you can see, is dark blue and red. And there was a huge gap. So it's better to have a higher score, which is what the normal population had. And you can see in the Perthes group, the scores were much lower. And this was true for all the 5 categories that we looked at: quality of life, pain, symptoms, functions in daily living, sports, etc. And this was also true for all the age groups that we studied here. And then looking at the, let me just try to advance this here. And then looking at the short form 36 general health, sort of similar finding, the gap not being as wide, but the participants had worse scores, except in the over 55 age group. So these 2 groups right here, we actually did not have enough number of participants to sort of do statistical analysis. But what you see here for the sort of younger age group, if you compare the light blue, which is normal male, versus the Perthes male, which is dark blue, you can see there is a difference. And then we saw a further sort of a gap between the normal female score versus the Perthes female score. So when we did the further statistical analysis, we found worse outcomes for females, those with higher BMI, and those with age at onset of Perthes after 11. So I'm going to put a caution mark here in terms of interpreting this data, because it is likely that more people with severe Perthes who are having symptoms or who are having issues probably participated in taking this survey, and they tend to gather more in the social group and support groups and so on. So the generalizability of our result is in question. We are not sure whether this really represents the general sort of the overall Perthes population or more of the specific population that are more symptomatic. The other thing to stress is that these people had treatment 20 to 30 years ago, and we have no information about the specifics of treatment, such as when were they treated, what were the specific treatment regimen, and what was the follow-up, and etc. So I just want you to have some cautious sort of a tone when you interpret the results that I've shown. So in summary, survey participants, especially females, had worse hip disability and osteoarthritis outcome scores and general health scores than age and gender matched normal population. I think this does reveal to us that more research needs to be done to improve the outcomes of Perthes outcomes of patients with Perthes, so that the children will grow up to be adults and have a more full and improved quality of life. So thank you for participating. I just want to just emphasize a lot of our funding has come from the Pediatric Orthopedic Society of North America, as well as Scottish Rite for Children, that supports the funding for our coordinator, as well as some of the IPSG activities. And just as a reminder that sometimes when you recover from Perthes, this is one of my patients that had Perthes, you could actually have a very active life as well. So it's not always dark and gloom. Thank you.